All right, guys, welcome back to Underground Science. In this video, we'll be talking about Wiskott-Aldrich syndrome. Okay, so let's go and get started. So first things first, this syndrome is X-linked. Okay, so it's more common in males to get it because remember, males only have one X chromosome. As for females, they have two X chromosomes, right? So females, they can have this mutation in both X chromosomes but and then they'll get it, right? But in males, if you have this mutation in your X chromosome, you only have one. So you just need one. I mean, you just need the mutation in your only one X chromosome that you have as a male, and then you'll get this disease. So it's more common to get this disease in or to find this disease in males. Okay. So what is this disease, right? It's X-linked recessive, and the gene that's affected is called the WAS gene. Okay, it's the WAS gene, and that gene is mutated. And remember, we know that genes, right? Our genes undergo transcription, translation, and we get proteins, right? For most of our genes, or for some of our genes, we transcribe it into RNA and then we translate it into proteins. So eventually, we can get proteins from the genes. And our WAS gene encodes the WASP protein. Okay. And the WASP protein, it turns out, is really important for the proper functioning of of our cytoskeleton. Okay. So it's important for the proper functioning of our cytoskeleton. Okay. And remember, if our cytoskeleton doesn't work inside our cells, then our cells won't work properly. So what cells does this, syndrome affect, right? It affects our immune system cells. So our T cells, right? So we get T cell dysfunction. It affects our B cell. So we get B cell dysfunction. It affects our dendritic cells, right? So our dendritic cells don't work properly. And it turns out it affects our platelets too, okay? Actually leads to small platelets. And we'll discuss why that's important, right? Turns out, so in this disease, we find small platelets. And we can even talk about it right now that one of the findings in this disease due to the small platelets is that these small platelets actually what happens is they go to the spleen and get destroyed. Okay. So that's why one of the findings in this disease would be low platelet count or thrombocytopenia. Okay, so these are the main cells that, due to the WASP protein not working properly, not being synthesized properly, right, because of the WASP gene mutation, these cells, such as our T cells, B cells, dendritic cells, and platelets, can get affected. Okay, so let's go ahead and see what we have next. So in this disease, we see a triad. Okay, in actuality, right, there's actually a nice mnemonic that helps me remember this. Is I just use the mnemonic water. Okay, for this syndrome that we're talking about, right? Wiskott-Aldrich syndrome. So I use the mnemonic water, or this mnemonic helps me. So for the W will stand for Wiskott, obviously, right? So and the A will stand for Aldrich. So the W and A helps remember that okay, this is Wiskott-Aldrich syndrome, and the TER, the T is for thrombocytopenia, right? The T is for thrombocytopenia. The E is for eczema, and then the R is for recurrent infections. Okay, so that mnemonic helps. And the findings that the thrombocytopenia, recurrent infections, and eczema is the triad that we have on this page right here. So let's go and discuss the triad. So why would you see recurrent infections, right? Remember, we said the WASP protein is important for cytoskeleton, proper cytoskeleton function. And if that doesn't happen, our T cells, B cells, and dendritic cells are affected. So we're going to have impaired dendritic cells, impaired B cells, impaired T cells. If we have impaired B cells, we can't secrete antibodies properly, right? And we know T cells are important for activating B cells, and T cells are important for fighting viruses and fungi, right? So if we have T cell dysfunction, we're not going to be able to fight viruses properly. We're not going to be able to fight fungi properly, right? And we're not going to be able to activate our B cells properly, right? So we're going to have decreased antibody production that way also. So not only do we have dysfunctional and impaired B cells, but due to the T cell dysfunction, even more you can't activate your B cells, so you have even more B cell dysfunction. And that can lead to recurrent infections because we need B cells and T cells to fight off infections. And then the second finding, part of this triad, is eczema. And the third finding, right? Let's erase this. I don't know what this is. And the third finding is thrombocytopenia. Okay. So let's go and write that, fix that. So thrombocytopenia. Thrombocytopenia is a low platelet count. It's a low number of platelets. And we discussed it in the previous slide, but the reason you see this is because you have small platelets in this condition, right? You have small platelets. And remember, all this is happening because of you don't have proper cytoskeleton function due to defective WAS protein, right? Due to the WAS gene mutation. So you have small platelets, and it turns out these small platelets, right, go to the spleen and get destroyed, okay? So then that would lead to low platelet count, which is called thrombocytopenia. And as we know, low platelets, right, can lead to skin and mucosal bleeding. All right. And then, of course, if you would do a peripheral smear, you may see small platelets. All right. But let's see what we have next in terms of talking about what types of infections you're more prone to in Wiskott-Aldrich syndrome, right? Something we should talk about right now is that, remember we said we have T cell dysfunction in this syndrome. So if you have T cell dysfunction, we discussed that T cells are important for fighting off viruses and fungi, right? And they're important in activating B cells. But if you have T cell dysfunction, then you won't be able to fight viruses properly, and you won't be able to fight fungi properly. Now, another thing is due to the T cell dysfunction, what actually happens is your T cells actually release cytokines that basically help that basically are more released by Th2 cells instead. So it's kind of like a skew or a shift, right? Your T cells are dysfunctional, so what they do is they release cytokines such as interleukin 4 and 5, which we know help B cells to produce antibodies such as IgE and IgA. But then what happens is this IgE and IgA may be elevated in the serum, okay? But you still don't have proper amounts of IgA in your mucosa. And the reason for that is because you don't have proper B cell function. Remember, we have B cell dysfunction and you have T cell dysfunction. So, due to the B cell dysfunction, you don't have proper plasma cell migration into your lamina propria intestines, for example, right? Where you have where you usually have IgA antibodies. So don't have proper, right? So no proper plasma cell migration, right? Because you need functioning and active B cells in order to have plasma cells, right? Functioning plasma cells. So if you have B cell dysfunction, as we said, we do have in this disease, right? Then you won't have proper plasma cell migration into your mucosa, right? Into your lamina propria, your mucosa of GI, of your GI system, let's say, of your intestines, right? In your intestines. So that's why you're more prone to infections in your intestines, like Giardia, for example. Right, so you're going to have low IgA in mucosa, in your mucosa, but you may have elevated IgA in your serum due to the fact that your T cells are dysfunctional and they're releasing more interleukin 4 and 5, okay? Which we know can help your B cells class switch and produce IgE and IgA, okay? But your B cells overall are dysfunctional. So just because they do produce more IgE and IgA, right? Because you have dysfunctional B cells, these antibodies aren't going to be as good for fighting infections in your mucosa, okay? Because you don't have proper plasma cell migration in your mucosa. So you see low IgA in your mucosa, but you may see elevated IgA in your serum along with IgE because your T cells are dysfunctional, and sometimes they tend to secrete more interleukin 4 and 5, which can elevate your antibodies such as IgA and IgE. But because your B cells are dysfunctional, right, you're going to see low IgG and low IgM antibodies, and of course low IgA in your mucosa, but elevated IgA in your serum, okay, due to the T cell skew, okay, because they may release more interleukin 4 and 5, but you're going to have poor migration of your plasma cells into your mucosa. So that's why you see low IgA in your mucosa, okay? So let's talk about what infections we can see, right? So again, we said that in T cell dysfunction, where did that go? Right, in T cell dysfunction, T cells are important for fighting out viruses, but if your T cells are not functioning properly, you can't fight out viruses properly, right? So what infections can you see in these patients, right? That they're more prone to. So they may get things like Epstein-Barr virus infections, herpes simplex virus infections, varicella zoster virus infections, and so on, right? And then what type of fungal infections, right? So a common one that we're familiar with due to T cell dysfunction, these patients may be more prone to getting Candida infections. Okay, and remember we said we have B cell dysfunction too, which leads to low IgG and low IgM production. Okay, and we know that IgG and IgM are important for what? Opsonization, right? And why is opsonization important? Well, remember, there's certain bacteria that have capsules around them, and we need antibodies to get rid of these bacteria. Okay, so these are important for encapsulated bacteria, right? Bacteria that have capsules around them. Now, if you don't have proper amounts of IgG and IgM, these encapsulated bacteria can then cause infection, right? So you can't properly opsonize and get rid of those pathogens. So those bacteria, for example, could be things like Pseudomonas, right? Bacteria like Pseudomonas, bacteria like Strep pneumo, and even Haemophilus influenza, and so on, right? So those are the pathogens that we should watch out for, right? Encapsulated bacteria. So let's write that up top. Encapsulated pathogens, okay, is what we should watch out for if you have low IgM and IgG, because IgM and IgG are important for opsonization. All right. And then, of course, we said that we may see elevated IgA, right, and IgE in the serum because your T cells are dysfunctional and they may skew towards cytokines usually released by Th2 cells, right, which are interleukin 4 and interleukin 5. However, this increases your IgA and IgE in your serum, but because you have B cell dysfunction, you don't have proper plasma cell activity or proper plasma cell migration into your mucosa of your intestines, right? So that means you're going to have low IgA in your mucosa of your intestines, which means you're going to have more GI infections. So you may see things, right? So more GI infections. So you may see things like chronic diarrhea, right? Due to something like due to a Giardia infection, for example, right? So you may see things like chronic diarrhea, and one pathogen we should know, parasite, right? Due to low IgA is Giardia, right? Increased Giardia infections and increased infections due to enteroviruses. All right. So that's also important to know. Due to decreased secretory IgA in the gut mucosa because of decreased plasma cell migration in your mucosa because of B cell dysfunction. Okay, as we see in Wiskott-Aldrich syndrome. Okay, so remember we're gonna have low platelets, right? So just remember the mnemonic basically for this for this disease is water, right? Wiskott-Aldrich syndrome, you're gonna see low platelets or thrombocytopenia because your platelets are small, remember. They go to the spleen, get destroyed. So you may see skin and mucosal bleeding, right? As you've already discussed. And the E, eczema, right? And this may be due to the increased IgE that we see, right? And we know IgE is a important immunoglobulin in terms of allergic reactions, right? So IgE, this may be due to the increase in IgE. And then the R is for recurrent infections due to B cell dysfunction and T cell dysfunction. And we said, remember that it also affects your dendritic cells. So your dendritic cells don't work properly either. Okay. So just remembering that mnemonic, may help. And as for treatment, right? As for treatment, we can consider things like IVIG, right? Because you're low in antibodies. So you may consider things like IVIG. You can even consider things like, obviously, you consider things like antibiotics, right? If you get infections due to bacteria. Like another thing for T cell dysfunction is that we should discuss, right? So T cell, remember we have T cell dysfunction disease, and this also puts you at risk for infections due to pneumocystis jirovecii, right? Remember that too. So for T cell dysfunction, you're more prone to viral infections, fungal infections, and remember pneumocystis jirovecii. Okay, that's an important pathogen also. So we should write that down too. Pneumocystis jirovecii. Hopefully that's spelled right. Okay. And then, of course, if there's severe bleeding, right, severe thrombocytopenia, you can give platelet transfusions, right? You can consider platelet transfusions since platelets are important for stopping bleeding and forming that platelet plug, right? So platelet transfusions. And then, of course, the cure for this, right, would be hematopoietic stem cell transplant. Okay, so you can give a hematopoietic stem cell transplant because remember the mutation, right, leads to defective wasp protein and in your white blood cells. So if you get a hematopoietic stem cell transplant, we know our hematopoietic stem cells are responsible for, right, making our white blood cells as part of the cell line, right? They make white blood cells, red blood cells, and so on. So so if we get a stem cell transplant, it's going to help create, new white blood cells that are actually functional. Okay. And then of course, remember because they can't really make proper amounts of antibodies, you don't want to give live vaccines, right? So avoid live vaccines like as like what, right, like MMR. Talked about this in the previous videos too, right? MMR, varicella, and even polio, right, the polio vaccine. And then that's basically it, right? So that's that's like the basic summary of um, Wiskott-Aldrich syndrome. I hope this video wasn't too confusing. Hopefully you guys learned a little bit. Thank you guys for watching and see you guys in my future videos.